Hey everybody, it's week 8, and they said it wouldn't last more than a month. Anyhow, it's been great. We've gotten a lot of feedback. We're actually going through the questions and finding out ones that we have already answered, or we've answered to detail. But really, the subject today seems like it's more about injections. I think because the procedures are coming back. We started doing our procedures about a month ago, meaning all the spinal injections and things like that, the PRP, the stem cells. So that's kind of been the focus today. I just want to start off again like I did last week. I truly appreciate what's going on. We're getting feedback. Most of it's positive, and even the negative stuff we encourage because honestly, I want to improve. I want to do better for what you guys are listening for, making it interesting for you. One of my patients just today made an obnoxious recommendation, which I don't think we can really follow through on Facebook Live, but we consider everything. But he said I need to spice it up a little. That's not going to happen today. I think he's listening. I think he knows what I'm talking about, but we'll keep it all PG for all our listeners. So to kind of jump into it, we're going to talk about the simple stuff. What are people being seen for through my telemedicine appointments? To be honest, it's everything. I mean, granted, we can't do procedures, we can't do the nerve test, but we're doing everything else. Like, I just had a patient that's in Alpena today, and she's been a patient for years. She was one of my youngest patients that I had to deal with and got her through her schooling and everything, and she's very appreciative. But today she's had a flare-up that's lasted the last 10 days. And to be honest, what I was proud about is that she went through her whole routine of what we talked about, all the things she needed to do when she had a flare-up. So the education of prevention was really there. Sorry, I got something there. Which was really, she doesn't know how that was such a compliment to what we do and my staff and my team, from Jules, from the therapist, just teaching you because you're going to have a flare-up. So this is someone I've been treating for at least 10 years, and she was a young teenager when we started, but she's been able to maintain herself and take care of her issues. Today she had a call because she's done steps 1 through 10 and she's still not getting better, and she wants me to inject her. So fortunately we were able to talk, and I'm trying to get her to do a few more things before I want to inject, which is the purpose of what we do. A lot of doctors will be like, okay, you want an injection, I'm giving you an injection. That's not what we do here. I've talked 3 people out of injections today because it's not always the easy solution. I can get you out of that immediate pain, but it's a process. It's not like, oh, here's the magic wand, here's the injection, everything's better. There's a purpose for everything we do. There's a philosophy behind everything we do. So getting back to the young girl, she's got to do a few other things before we consider injections. And I'll tell you, when I hold off on injections, probably 50 to 60% of the time, they don't need the injection. So the injection it's not that it's so involved or it's a problem or you can't have it. First of all, you can only have so many per year. It's not the best thing to put steroid into your spine on a frequent basis. So if you're going to a physician that's doing that and saying it's not a big deal, it is, and it's a cumulative deal. It may not be today, but I always try to look down 10, 20, 30 years, especially as I've aged myself. Everything I was talking about when I first came out is really coming true even for myself. So you really have to build your infrastructure. So to answer the question completely, what are we doing on telemedicine? We're pretty much doing everything. It's surprising how much I can do. I got patients going through maneuvers. I got patients pointing at certain areas of their body. I got patients laughing because I touch certain areas that's a sensitive spot. And they're like, how do you know that? It's just the 20 years of experience, and I listen to the patient. I had another person comment to me, is like, it feels like you're not fully listening. The thing is, I am fully listening because I ask my questions up front. I get to the answer of what I do. So there's a process of how I start asking the question to get down to the diagnosis. The patient may want to continue talking about other things, which is great, but I still have to document. So he thought while I was documenting, I'm not listening. But fortunately, some people are looking at my forehead and top of my head because I'm down writing, because we still have to keep all of our paperwork up to date, our electronic medical records, whatever we're recording on, still has to be done in that visit. So it's just, we're trying to be efficient. So everything from acute pain issues with your neck, your back, is still our big things, but all the sports injuries, all the non-surgical stuff. And the other thing that's come up multiple times, and actually it's really been a good thing, and I think this is what's going to move towards the future, is getting second opinions. There are people like you hear about in Tampa Bay, the surgery center down there, get your opinion here. And they were broadcasting, it was more of, cash pay situation. But I think it's translating to telemedicine, that you can get to certain specialists that are very well respected in their field, that you're getting another opinion. There's plenty of people that we've talked about, and I mentioned it I think last week, that I deal with the highest level of entertainers and athletes where they've been told by certain specialists that you need surgery. And with the proper program and the proper team, we've avoided a lot of surgeries with big names that you would know that haven't had to go under the knife. It doesn't prove out that 10 years from now they may have to go under the knife, but right now they're outperforming without any issues, especially when COVID comes back, everybody's in their rehab program itself. But it's not just the entertainers, it's the handful of people that we've been getting now. We seem to be getting momentum of people calling from other parts of the state, other parts of the country, that what's the opinion regarding this surgical issue. I mentioned the one last week that we did one from California, that there was surgery that was suggested, and I kind of relieved her that there's multiple steps before she needs to go for surgery. So, and she's progressing very well. So hopefully that works out. So moving along, basically, again, a lot of the questions have talked about injections. So I kind of touched on it, but it says, can you tell me why you can only do one injection in the hip when you can do multiple injections on the back? So what goes on is, what you want to do in a joint, the joint is more sensitive than the spine in some ways. So the joint itself is truly, you're only supposed to inject it once every 6 months. And what happens, which I've talked about multiple times, and I'm starting to promote more of the PRP, the platelet-rich plasma, because the steroid, even though we've been doing it over 20 years, when you really break it down, can deteriorate the ligaments in the joint if you have multiple injections, which you try to avoid. There's early on in my career, when I was in my training, we were at the VA, the Veterans Association, and there was doctors there that they would carry a steroid needle just to inject everything, because these military people were achy everywhere. I saw more torn tendons, ligaments, and everything. So like my chief residents and my superior attendings at the time said, look, you can learn good and bad from every doctor. And what I learned from that doctor is that he's causing a lot of issues with tendons that is leading to prematurely tearing the tendon. So that's what you really don't want to do. So when you inject a joint, make sure it's in the joint. If you're injecting the tendon, it's much more sensitive. You've got to have a certain protocol once that happens. So when you're referring to the hip, I actually it's called an intra-articular injection. So I'm going right into so it's a ball and socket. I'll put medications right at what we call the 12 o'clock position on that socket, and it bays all the way around the joint. And then we only try to do it once. When we move to something like PRP, which is platelet-rich plasma, it's a total different aspect. It's a strong anti-inflammatory, similar to steroid, but it has regenerative properties and healing properties in there. So we're looking at that as a much better tool and much better injection, much better results on a long-term basis. The biggest thing with that is when you get a steroid injection, we put a little lidocaine in, we put the steroid, which means that you get that numbing sensation. So you get almost instant relief within 20 minutes. With the PRP injection, the platelet-rich plasma, you actually can cause a volume effect. So again, taking the hip joint, we go into the joint, that intra-articular injection, you actually create a volume effect, because what it's doing, it's signaling everything else like a cascade coming there to help. Like, hey, what's going on over there? And they all start running to the area. So you actually can feel worse for potentially the first 10 days. Usually it's about a 2-day period. and that kicks in over time. So you're not seeing the results for somewhere between 4 to 12 weeks. So it's a much better long-term thing, but it's a different philosophy. And if I don't educate the patient, or you're not educated in it from whoever's doing it, then you're gonna have, you're gonna anticipate a whole nother issue. So that's the biggest reason. As far as the spine itself, the reason we can do multiples is because of the area. We're going into the epidural space, we're going into different areas which can tolerate it, and that's kind of been the golden standard. So leading to another question, Dr. Pierce, I've had somewhat of a setback since the COVID thing started. I've had lower back pain with a pain level ranging from 4 to 6 throughout the workday and about an 8 when I get home. I start physical therapy again next week, but is there anything you suggest in order to spring back from this setback? So it's really been the theme and the philosophy of a lot of this, the Facebook Live stuff that I've been doing, and we're now on Instagram. But that's been the whole theory. I've been talking about this. I've been talking about prevention. I've been talking about how you need to gain your flexibility. Take this time. I'm pushing yoga. I'm pushing Pilates. I'm pushing our home exercise programs. Right now, that's still the same message. I'm not changing. Unfortunately, when you have a setback that's causing, what we were worried about is the back pain and the leg pain. When you're getting the leg pain, it's much more concerning. So when you're getting the leg pain, that tells me for sure that you're having more of a pinched nerve, a nerve irritation, a hot nerve, whatever you want to call it, that needs to calm down right away. If that doesn't calm down right away, you're just going to get into that snowball effect, potentially get back to your pre-time of seeing me or what brought you in, or seeing a doctor or suggesting potential surgery. So what you can do is, number one, you go back to your basics. You go back to the medication. You go back to the simple stretching and advance it as quickly as possible. To be more proactive, it's just the same message I've been sending. When you're feeling good is the best time to build up your core muscles. And we talk about core muscles, everybody's making fun of me. I'm pushing from the belly button down to your privates where your pubic bone is, both in front and back. You have to get the flexibility and the strength in those muscles, or your risk of re-injury is heightened every time you go back to work. So the classic thing is, you haven't worked for 3 months. I've said this multiple times. Your natural conditioned muscles from work are now lagging. They're now weakened for the 3 months, on top of a problem with your back. So you get a snowball effect of multiple things going on, which is leading to the problem, which this patient is having a classic issue. You're kind of struggling through the day, and then you're trying to relax at home, and actually you're a little bit more focused, and the pain level might be going up even more. I don't know exactly why your pain level is going from 4 to 6 to 8 when you're done with your work day. It may just be because your mental capacity is, you're focused on your work, you got to get through it, the adrenaline's running, and then when all that goes away, you're feeling the pain level go up. So what you need to do multiple times throughout the day, so my rule is you don't do something for more than 20 minutes straight. You either change positions, you do something. You can't sit there on the ground and do all your stretches, but you can do things to stretch out every hour. So it's a 5-minute thing, and maybe just lifting your arms above your head, stretching your back out, lifting your chest up, throwing your leg up on a table, putting your leg up on a stool, just breaking those mechanisms of the constant repetitive muscle tone to hold you up against gravity. So the biggest thing you got to do is figure out how to do some type of stretching throughout the day. Ideally, don't stay in the same position for more than 15 to 20 minutes. And that doesn't mean you get on the ground and start stretching and laying down and I got to take my time and all that. You've got to be able to incorporate it into your work. There's a lot of people working, like I've mentioned multiple times, they're actually working overtime, especially with the assembly workers, they're working longer shifts because they want less people transforming in and out of the building. So again, physical therapy is going to be great, your medications, but you need to start doing aggressively your stretching at home. So that's at least 20 to 30 minutes before you go to bed, about 30 minutes before you go to bed, you got to do your stretches before you get in bed and sometime during the day. So I don't know if you're going to need to take your lunch hour to do some of the more serious stretching if it's not working. And if it's lasting more than 2 weeks, then you need to get in and make an appointment because we don't want this to snowball. We don't want to lose everything we've gained by just scheduling or stubbornness or whatever. 2 weeks are the rule. If it's not getting better, if it's getting gradually worse, you need to get in. Another question. I consider myself intermediate from an exercise or fitness perspective. In your opinion, what's an ideal full body workout? P.S. I'm 46 years old, but don't mention that on your video. Well, I guess I screwed that up. And it is, we're getting into that age, and it's a decade thing. Everything just doesn't bounce back as quick. When we talk about full body exercises, and I'm not going to get into it now because it's becoming very, very common in certain communities, especially in the workout communities that want to stay fit, this CrossFit stuff. There's things with the hormone replacements, there's things with peptide replacements, IV fluids, IV therapy. There's a lot of stuff that we're starting to learn about. We started with testosterone, testosterone replacement. Does it help your metabolism? Does it help your muscle building? And to be honest, it all does. We're starting to understand it. Do we understand it fully? Do we know all the side effects? Do we know what's happening 10 to 20 years down the road? I don't feel 100% confident, but we're definitely more confident than we were just 5 years ago. I used to have bodybuilders when I was in with all the football players. They have to do something to beat the next guy. It's a very competitive world. Everybody needs to get an edge. So those are things we can talk about. To get to what is the ideal full body workout, ideally you want to do full body stretch. So I love, I'm even doing it now more so as the full body yoga routine, where you're getting full body flow, where you're getting your body full. You don't realize over the years how much you've kind of crawled into a little space where, 25, your neck's up, your chest is out, you're not aching from your back. You don't realize that you've changed your mechanics. Okay, I've solved a lot of those issues with our aggressive therapy program, which is focused on the stretching, focused on full body. Like I always mention to these guys that want to work out, if you're going to work out an area that's already shortened, like even your biceps, the guys that walk around like they're muscle guys, they haven't lengthened their whole muscle, and that becomes a problem. I've had bodybuilders, rip chest muscles or rip biceps because they're just so tight in here that when they reach out or they do something like it would be a normal functional activity, but because everything's so short and tightened, something's got to give, and they'll tear that muscle because you're not going to rip the bone. Most adults won't rip the bones. As opposed to young kids, you get things like what we call avulsion fractures. You don't want to have that. That's a terrible, it's a bad thing to have, which I worry about with a lot of my young athletes that are going back to this aggressive, getting ready for tournaments, especially with baseball right now. Baseball is really pushing to get back to tournaments, and these kids are on shorter time frames, including the MLB. You need to worry about that. So getting back to the full body yoga, if you want a conditioning, I always push an aerobic activity. If you're like someone that works out 7 days a week and you can switch it, but if you're another person that just, I got to get in as much as I can 3 to 5 days a week, you always want to do a warm-up. You always want to do what we call a dynamic warm-up. So it's warming your body up. If you watch the pictures of the football players pregame, if you follow the sports like that, you'll see that they're doing all these weird mechanical movements, but it's there to functionally move out, open their hips, to open their spines, open their shoulders. Even your core muscles need to be tall and stretched out. So what it does, it creates a full body, to simplify, it's like your fluids are moving. Everything's moving when it's all opened up. So if you start trying to exercise and you don't open that up, think of pipes. If there's a certain clogged pipe and you don't open that up, everything's going to start moving away from that area. So you're going to overload, change your mechanics, which is so important, is proper mechanics with everything you do. If you alter the mechanics, you may get by the first couple times. But that's where the sore hips, the sore knees start coming in, the sore elbows. When you're benching and okay, I'm just going to do my normal workout and I only have 5 minutes, I got to be somewhere in 45 minutes, I'm going to do it quick. You start changing your mechanics, you start pushing a little bit different. That's when the shoulder has a certain way it moves. It moves through that ball and socket joint. Well, if you have a little tendinitis in your bicep tendon right here, you're gonna like alter that movement when you push up. You may go a little bit wider grip, you may go a little easier in, but it's gonna alter your mechanics, which, yeah, once or twice you might be able to get through it. But if it becomes a habit, now you're wearing out that joint. So one of the simple examples that I give in this case is when you drive a car and one tire is 4 pounds less than the rest of the tires, or it's a little bit out of alignment. The tire's still gonna work, you're still gonna go. But what eventually happens, you start wearing out that tire prematurely. It starts wearing the tread differently. So that's the same thing like with your body and your hips and your knees and your shoulders, which are the easier big joints. That's easy to see. Your ankles, if you're walking out on your ankles incorrectly. To be honest, I just had this discussion with my son last night. He tends to toe in. He's very weak on the inside of his ankles, and he's yelling at me because the exercises hurt because we're trying to get him so he's back on the outside of his foot. He goes, well, my buddies do it. They're not complaining. They're not looking at what 10, 20 years of wearing that is, because if your ankle's like this normally and it's falling in, so this is the outside, this is the inside where your arch should be, if that thing falls in like this and you're constantly getting weaker on the outside of your foot, like the classic thing I do with my kids is, can you do toe-ups? Can you do it without your big toe? There's so many kids that are weak on the outside of the foot that's going to collapse your arch, which eventually affects your knee differently, affects your ankle differently, affects your knee differently, affects your hip and then your back. So it's not a process that happens overnight. That's why I'm so pushing with my son who's 13, that I know what it's going to happen if we can't correct it as best as possible. So you really need to take in what the mechanics are like. So even if you're 46, 26, or 16, I need to look at your mechanics. You need to be aware of it. The mirrors at gyms are not just for you to look pretty, it's to watch your mechanics and how you're maneuvering. So hopefully that answers your question with that. If you need to, be happy to call and I'll talk more. The last questions, I've done 5 rounds of injections with another doctor. They helped temporarily, but now I'm basically back to where I was original pain-wise. Now what? So it's funny, I had a similar patient just this week who, because we're with Priority Health, we're considered a center of excellence for spine, for HAP, for BCN, and for Priority Health. For this patient, it was Priority Health. He went to another doctor who I actually know, and I know he's a good physician, but what he did, you have to understand, when you have an injection, the simplest thing I can say is going back to Physics 101. When you push fluid through a pipe, and there's an obstruction, the fluid's going to always track to the place of ease. So think about your spine as a pipe, and you're pushing fluid in it. In this case, that's what the doctor did. The problem's on the right side, the 5th level in your back. So when I push that into the pipe, just blindly into the pipe, and I'm pushing 10 cc's of fluid, where's that medication going to go mostly? The medication's going to flow away from that area. It's not going to, it doesn't have some special mechanism to bathe around, oh, there's a problem there. It's not that way. You have to make sure what we call double whammy, which I've talked before. You need to block the nerve where the problem is. You have to be at the primary pain generator. I don't know what kind of injections you had. If you had a simple epidural, this is a classic issue, that it kind of bathes it for a second, but it doesn't treat it. If it is a good injection, and you are through 5 injections, and you feel you've gone to quality therapy and done real compliant with your program, then that's an issue where we may have to bring surgical intervention in. We are doing stem cell, we are doing PRP for this, which is showing great promise. There's guys around the country that are doing it very commonly, and I've talked with them and we've worked with them, and they're getting unbelievable results, and that's kind of where we're heading. So that's another tool that we're going to be able to use. So I truly feel that the PRP, the stem cells, the regenerative medicine, there's so much that we need to uncover. The peptide, which Dr. Abrahamson's going to be bringing to our practice, which she's a phenomenal physician, she'll be doing that, so she's going to be able to take it to a whole nother level than what I'm doing, and the combination of us working together is going to be great and beneficial to a lot of the patients, but you have to be open-minded to that. Right now, FDA guidelines are not necessarily respecting it, but they're always behind the curve of doctors, again, who I say can think inside the box and know, but we're knowledgeable of everything else that's going on out there. So we truly want to be a cutting edge physicians that are looking out for the best interests of you. So with all that, it's a big holiday weekend. Everybody wants to be gone. I'm feeling terrible because I'm going to be here working. Everyone I know is going to be gone, but at least spread the word. And I'm trying to come up with a good comment on how to end everything. And we're starting to bring in guests. We're hopefully going to have to figure it out so we can start bringing guests. I'm really going to start talking about sports issues. We're going to be bringing in how football training is going to change. We got a big football coach. We have one of the big hockey guys from the Grizzlies coming in, an ex-NHLer who's going to be coming in, and then lacrosse, because my son's coaches. So it's just kind of how the world's going different and what we need to do to change it. So I also need you to comment on how I should end it. So I'm going to end it today as peace out, love you guys, and have a great weekend. Be safe.